Hi, welcome to the webinar. I'll give you some, this is what we're expected to cover tonight. We've got a real overwhelming number of attendees that are joining, but we're also going to record the webinar so that people who haven't managed to get on to the webinar will be able to listen to the recording as well. With a few administrators to help us through, so there's myself, I'm Julie Stansfield from In Control, we've got Gaynor from In Control, and we've got the help from Kerry from a Levy Corona group that's supporting us. And then we've got a number of guests who are going to share their plans to help us to start some of the discussions and questions. And I'll show you how to ask questions. Some questions have already come in, so some of you have already started doing that already. And then what we hope is that there'll be some helpful links and next steps. We hope that by joining and sharing, we can ease some anxieties around things. We might not find all the answers tonight, but I'm hoping that just by linking together and sharing, we might get some ideas and solutions and support together. And if there are any sort of joint mutual issues that people want raising, either with CCG's NHS or with social care via the Association of Directors, I'm happy to pick them up and take them forward to try and get some of the issues raised. Okay, so here's how you can participate. With the number of people actually on the webinar, I think it's going to be really difficult to get verbal questions raised by hand because there's so many actually on the webinar that we might not be able to administrate everybody individually verbally asking for things. So we probably will do more of this option, which is the question. So you'll see on your panel that there's a question box and people can submit written questions and we will read them out online and try and get some discussion going then on the questions, or even suggestions, helpful links that you found around that would help other people would be really, really appreciated. We've just reached our maximum number now for the webinar. So we've got our guests, and the first guest who's really kindly agreed to share what he's doing around this is Miro Griffiths.
Okay, so do you want me to start now?
Yes, please.
Okay, so I'll just talk for a few minutes just to give people a little bit of context, and obviously I'm happy to take direction based on the questions. And of course, I'm happy for people to give me an email afterwards as well if they want to have any conversations. You can, if you Google my name, you'll find my email address, or I'm sure it will be here somewhere. Just for quick context, so I have 24-hour assistance from a team of 7 personal assistants. That's funded via a CCG, taken as a personal health budget. So when I realized what was happening in terms of the difficult situation, I immediately tried to coordinate 4 areas of consideration and protocols. So the first consideration is around working in the house. The second area is around the risks of exposure. The third area is around contingency planning. And then the fourth area is around reliance on medical care if we do have to go down the route of medical care. So in terms of working in my home, we're obviously taking the guidance as best we can in terms of where necessary, keep a distance away from me. But when there is a requirement to provide very personal, intimate care, I have 24-hour assistants because I can't really use my arms for anything. There's a case that we have to obviously breach that, but we have to take considered measures. So it's a case of regularly washing hands before there's contact. Also, then obviously minimizing the distance. Sorry, moving away from each other as best we can. And then the risk of exposure, it's a case of when people are coming in, obviously trying to cleanse and wash themselves before they come in. We have also considered about the idea of keeping a spare set of clothing for PAs in the home so that they can change into when they arrive, and then they can bag their clothes for the clothes that they've entered if that's a concern for some people, because obviously there is levels of contamination on the clothing that can last for a few hours. There's also the issue of contingency planning as well. So just give a brief outline of that. We've obviously had situations where what happens if a PA goes down. So today, for example, I had a PA went down because a member of their family is suspected of having coronavirus. So we've immediately suspended all their work for 14 days, and we have a backup system where we're asking PAs in a very collaborative, supportive way to just try and be available as best they can to cover other people's shifts, and obviously we can then change that in lieu and give people time off in advance. Give people time off in the future if that is to happen. So it's also about trying to recognise, what's the current regime and routine for having PAs in terms of their allocated hours, and then speaking to each PA and seeing where the flexibility is in the system for when people go down. Now, the other contingency is that if I have a number of staff go off, do I have any members of staff who may be able to move into a live-in PA situation where they can remain in their home, providing that they don't have any of the symptoms? Now, if people are moving towards a live-in PA system, then you do have to think about whether somebody can stay in the backup PA can stay in isolation for 7 days, and then you can have a swapping round, in terms of the new PA coming in to relieve the existing live-in PA. At the moment, I've got PAs coming in and out, and we're okay with that at current, but we are starting to plan for a live-in PA situation if that's the case. And of course, the fourth issue is around medical care and what you'll do if you do develop symptoms, and I've got a plan of action agreed with my consultants around that. And of course, where possible, I will bring my PA support with me into hospital if that's the case. The other thing to consider, and this is my kind of final point, and obviously I'll then take questions from people later on, is we have to think about the conversations we need to have with CCGs. And I think, if you take the advice of Professor Tom Solomon from the University of Liverpool, and indeed the Deputy the Chief Medical Officer, there is now a clear demand, and I would have broadened out to social care, workers being tested if they go down, because we need to know that if they do have it and they do progress through it, then the question of is when can they return back to work? So I think there needs to be a strong conversation to be had individually with CCGs or with your local authority funders, as well as more of a coordinated activity here to talk about the idea of testing. And perhaps that's something we can pick up. But just to summarize, I think people need to plan for 4 areas: working in the house, risk of exposure, your contingency planning, and then of course the emergency situation if you yourself go down with the symptoms.
That's great. Thank you so much, Miro. And by all means, do use your question box if you have any questions, and we'll be around and we'll make sure that any questions are recorded and we'll take them forward. So the next person who's going to help by sharing her plans is Liz. Liz, are you happy to introduce yourself?
Yeah, I'm Liz. I've got a daughter and a brother with Down syndrome who my brother has very high support needs, and my daughter lives with me. And I've been updating plans and discovered that my daughter's is actually 6 years old since I updated it, which is shocking because I know better than that, but there you go. So what we've started by doing is having I just drew up a top to toe jotter, because there's so much that we do supporting people who don't use words too much that is instinctive and as natural as breathing. So I wanted to get something to help me to remember everything that I do. Have you got the slide there, Julie?
I do.
Or someone's got some pictures. Anyway, it just felt like using a bit of a body map to go through the detail got me thinking about the things that I forgot, like folding up, like fastening a bra before putting it away, the kinds of things that people other than me wouldn't know for Elsa. And we're in a situation where actually I'm now working from home, so we don't need much PA support at home. But should I be ill, then there's too much in my head that needs to come out. And the same goes for my brother. He's got a brilliant team. They've made all of the contingency plans that Myro have spoken about. But if they all go down at the same time and we face people who don't know him having to look after him, then we need really detailed essential lifestyle plans. So, and that can feel a bit overwhelming because actually there's loads to write down, and I know to do everything for both Kenny and Elsa would take me, I don't know, a couple of weeks if I spent 8 hours a day writing all the detail down. So on the next slide, I've kind of divided the things in the top to toe plan into absolutely essential, the things that, you know, just have to be done every day, and things that either Kenny or Elsa could live without for a couple of weeks in a crisis. And I feel properly guilty about that, but I recognise how important it is for us to remember that these plans aren't the aspirational, you know, positive North Star plans that we make in ordinary times. These are plans for getting through a fairly significant crisis. So the next thing I did from after jiggling them up was go back to that old familiar friend, the circle of support, and go through that, making a list of people's phone numbers, the relationship to both Kenny and Elsa separately, and what they might be able to do, and then asking people and being really specific. So like my sister who lives miles away, can you ring Kenny and can you FaceTime Kenny at 7 o'clock every evening? And then making plan B where people are willing to get roped in for more. And also I think the other flip side is offering what you can, and what I've got to offer from Elsa's support team is that we don't, because we're self-isolating, because Elsa has underlying health conditions, Elsa's PA isn't needed at all. So I've asked her to go and work where people live on their own and don't have that family support, and can make better use of her time, and she can stay in touch by phone and FaceTime, because obviously she's a really important part of Elsa's life, but we don't want her coming along and being an infection risk when that's not necessary. And then finally, other things that people might help you, and I'm assuming that most of you here have done quite a bit of person-centered planning and that kind of thing over time, is to really update those one-page profiles. You know, it's a great introduction in an emergency. It's what you need to do if I'm whizzed off to hospital at the last minute without able to put my own plans in place. Having your list of emergency contact numbers perhaps laminated and by the front door. A list of alternative things to do, including favourite films, distracting treats, whatever it is that's going to get somebody through a week or so with unfamiliar people supporting them. And remembering to share your emergency plans widely. Email them out to family, friends, PAs, anybody who might be helping out in an emergency, and make sure you've got extra ready. And the final thing that I didn't put on the back, the sheet, because I thought a bit later, was make a hospital grab bag with your updated passport, a few essential and one-page profiles in it. I'm happy to be contacted. Facebook's probably the best place to get hold of me. Or Twitter.
Thanks, Liz. So we'll make sure that things are around on a range of media. Facebook, we'll get it on a website as well. We'll also try and get some hard copies if people need that. So next, Will.
Thank you, Julie. Hi everyone. My name's Will Case. I have been an individual employer on a personal budget for 10 years, and I run a social enterprise that supports some of the disabled people. So my conversations that I've had with my personal assistants around the issues that we're facing at the minute is to have direct conversations with your PAs. That I found is a useful tactic to use, especially around how you want to be supported while in the home, and picking up on some of what Meryl said at the beginning of making sure that things are even more cleaner in the home than it would be normally for your personal assistants coming in, and having those conversations around what tactics to put in place while if he was to get corona or your personal assistance, and finding out the best ways and the best tools to use. So my team of PAs that we found the best tools to use at this moment in time is to doubly wipe everything down and check in with each other on a daily basis, either before they come in to work with me, or seeing if we can perhaps look at the food that I have at the week and to see if we need any extra, not to stock up, but extra food that I may need if I'm going through a bad time. And particularly yesterday, that my main PA Dominic noticed that I was low on my one of my medications of diazepam, which is quite hard to get hold of anyway, but luckily we put measures in place for me to get that. So it's having those open conversations and making it open and transparent, and also using, if you have your support plan or your staff handbook, going through that and possibly updating information in that if you was to get any of your backup PAs that have not necessarily seen that before. So it's about being calm and collective about it, but having a open approach to the situation. And I'm happy to also take questions when needed as well, Julie.
Brilliant. Thanks, Will. And next we've got Karen. Karen, can you introduce yourself?
Yeah. Hello, everybody. I'm Karen, married to Gavin, and we have a personal health budget, and I've done for 7 years now. We have 24-hour support flexibly throughout the week to support Gavin and manage his needs. So similar situations, really. What we've done, we started from the premise of stay calm, stay clean, stay safe. So it's wash your hands, wash your hands, wash your hands. As other people have said, every opportunity, wipe down. It's about being practical in our house, because it is a very, very busy house, and that's part of the problem. Gavin actually has been self-isolating for about a year without knowing he was doing it. So it's not about him being out, it's about the number of people that come in, and that includes a team of PAs who come and go throughout each and every day. So what we've tried to do is recognise that in an ideal world, we need that support to actually just get through the day. But rather than have people coming and going, we've had discussions, and some people are doing longer shifts to minimise the coming and going. So, for example, they might come Monday morning, they'll sleep over Monday night, do Tuesday, and then go home at 10 Tuesday night. So they're there for probably like 30 hours as opposed to being there for 9. And we're trying to work that in. They've been agreeable with that. They've been really, really good. What we're trying to do is limit the number of people actually coming into the house, because they've all got children, they've all got lives, as we all have, you know, and somewhere along the line something is going to happen. So what we've tried to do is recognise that something's going to happen, as well as minimise the comings and goings. We already have emergency information, because sadly Gavin does go into hospital relatively frequently. So that's already there, what he needs, how he needs it, who can support him. The PAs have been in hospital with him on previous occasions, and that will happen again, providing they aren't ill, obviously. So we do that between us. We've got all the stuff ready and packed, including medication and everything that he needs to take, including his machines. But should the PAs go down what we've got, and I appreciate that, we've done what we call the mobilising of the troops. So it's around people who are very well known to Gavin, who Gavin is happy to accept some support from him. Obviously, being very honest, I think some areas of more personal, intimate support will probably come to me, which is fine. But people could pick up in other areas while maintaining his dignity and not being too invasive. So we've got a list of what we call them Corona heroes, but I'm not sure that's the right word anymore. Backup of family and friends that are known very well to us, recognising they can't do everything, but what we can do, we've got a little, it's not a training session, but we've got an informal breakfast and a discussion planned for Friday this week to actually get them up to speed about where we are, and they can ask those awkward questions. So we've got like our own little Gav's Army ready to go. It should be too, which I hope we don't really. We've got, we've talked to the PAs about being more flexible. The discussion about pay has come up. Do we pay them? Can we pay them? How do we pay them? What happens to the money? And the honest answer is, at the minute, I'm not sure what we do. But, you know, that's where we are really. You know, there's just some suggestions about being prepared and be ready, but just try and maintain yourself at home in the best way you can with any support that you've got. Okay, thank you.
Lovely, thank you, Karen. Okay, before we go on to the links, Terry, can you see the questions now?
I can, Julie, yes. I've been trying to quickly make a bit of a kind of theme of them, really, yeah.
Do you want to take us through some of them questions?
Okay, yeah, I haven't got through all of them. We just had a bit of a technical problem getting me access to the questions, everyone, so sorry. But I think we've got some questions around protective equipment. Can people use a personal budget or a personal health budget to be purchasing protective equipment? People are asking about, what do I do to protect my PA or my PAs? What do I do if my PAs go off sick? Colleagues from Skills for Care are asking, can we share the webinar? Can we share the recording? Because it's going to be really useful for them. We've got questions around how do we basically keep people safe? We've got a PA asking, what happens if my employer becomes sick? What are my rights? And Miro, Michelle says, thanks for your ACE advice, and could we put this into a leaflet? So those are the ones I've got so far. If you want to just take on to the next step, Julie, I can come back to summarising some more in a second.
Yeah, I will do. Yeah, there's some specific questions. With the protective equipment, that's something that's already been raised with NHS England across the board, so specifically for people on personal health budgets and personal budgets. I've tried to make sure that you're on the same list as sort of mainstream agencies and other providers going in for the personal sort of protective equipment. This, as you'll all know, which is why I think we've been so oversubscribed to this webinar, there's not a great deal of information out there, as in formal advice. So people have already seen the advice from NHS, from the government, and there's some new information from Public Health Matters. There is some more guidance that's due to come out from adult directors of social care and also from NHS England. They're expecting that to be published by the end of the week. So we'll certainly keep people informed for the more formal advice and support. For things that aren't formal and that are more like this, that's about people sharing information, or trying to get connected. I noticed one of the questions said, it's fine if you've got family, but what if you've not got any family? Certainly that's one of the issues that Karen and I were very concerned about. Hence we started launching the Carina Heroes, and I know that has a connotation in itself that bothers some people, but it wasn't. It was meant to be everybody helping each other in neighbourhood. So there is people around there now. It's not ideal, but it's there. It's sharing good information, and some people are already saying, look, I'm a nurse in a nursing home, the nursing home's shut, I live next door to such and such a body, I'm going to go in and give some direct support to them. So it's very just hands on deck, neighbour to neighbour support. And there are groups that are collating now across the country, which COVID-19 mutual aid are collating all them groups. So there's a link there so that people can get these groups around their local areas. Should we get back to some specific questions?
Yeah, do you want me to pick some out, Julie? Yeah, so I think we've had some. You've answered, probably answered some of the stuff around protective equipment. We've got quite a lot of concern around contingency planning and how people make contingency plans. I think for people who are on much smaller packages of support, the contingency is a little bit harder because you haven't necessarily got PAs that you can rest and then swap around. So what might be our advice on that, really? Somebody's asked as well, Miro, you talked about your kind of first stage plan around keeping your house clean. What extra are you doing to make it more clean, I suppose, to protect yourselves? And another kind of Alice has said she's been using some information from mindheart.co, which is designed for people with dementia to explain COVID, and that's been really, really helpful. Maybe useful for, oh sorry, no, she says it hasn't been really helpful. It may be useful for others. Wish everybody the best of luck. So that's where we've got to so far. Do you want to take some of those specific ones, Julie? So I think something around what happens, worrying about what happens about PAs being sick, and then what happens about employers becoming sick.
Yeah. So, I mean, I think, Miro, you were answering some of them in your presentation, weren't you, on your PAs down?
Yeah, so I think there's a couple of things I would do strategically. One is, if you have local PAs in your area that you have previously used, perhaps, and they've moved on because, you're on good terms, they've moved on, it might be worthwhile making a reserve list of PAs that you've used in the past to see if there is some possibility of either employing them on a temporary basis to cover if, particularly if PAs go down. So whenever a PA moves on, if they've moved on good terms, and i.e. I haven't sacked them, then I would have a list of them where they've gone to and their contact details, so that if things happen again, you can go in and do that. On the contingency, I think it's about, I have an Excel spreadsheet with all the shifts allocated for a month in different colors. So and then I also have another document which tells me what days of the week PAs are flexible on. And obviously that might change on a weekly basis, so it's always useful to update that. And what I can then do is I can then look at the two documents and see how do I, is there room to move people around if somebody can't do a Tuesday, but I know another PA can do, and then that PA who can't do a Tuesday could do a Friday because of issues that are going on outside of the workplace because of the continuously changing situation. Another thing that I found quite useful, particularly for your own kind of stress levels and responsibilities, because of course the whole idea of personal assistance is that it takes you away from having restrictions to do the things you want to do in your life. There's also a possibility of identifying somebody within your PA team who can be the first point of call for any kind of problems that are bubbling away at the PA level. So I have one member of staff who's been here the longest, and any kind of issues around swaps or around discussion around cover firstly goes to him, and then he will try to address and plan what could happen, and then he comes to me to approve it before it's implemented. So that again relieves some pressure from you to allow PAs to discuss with each other. But I think the contingency is is hard, and obviously it depends on the level of PAs that you have at the moment, where you are, how good the PA system is in terms of accessing the labour market in your area. Another option as well is to use websites like PA Pool. You can have a look for temporary PAs who may be available in your area as well. It may also be worthwhile looking for any centres for independent living or DPOs that are operating in your area, so disabled people's organisations, seeing if they also have a PA network that you can tap into. So I think there are some options you can have, but obviously if people have exhausted those options and it's not working, then of course we need to try and talk a little bit further in more detail. Just going back to the PPE situation with the protective clothing, one thing I would say is, shoot off. It would be shoot off. You've got your assigned contact. You should have a signed contact. An assigned contact in your CCG. It may be worthwhile sending them an email saying, "Look, I want to do this," and just informing them of it. And if they don't come back with any concerns, then you can go ahead and utilize your PHP or personal health budget to acquire equipment that was suitable for meeting your needs. Also, if your personal health budget is being delivered by a civil society organization like a DPO, so for example, where I am on the Wirral, we have Cheshire Centre for Independent Living, who provide who do all the kind of administrative issues to do with the PHP. So again, talking to them or talking to the administrator is also a useful way. But I would think we need to be quite strong as a collective and say, we need to make very instant decisions now, to protect you and to protect your PAs. And I think as long as you're not doing anything illegally with your personal health budget, you should be more. I encourage people to be assertive, not to ask, but to tell people in the CCG, this is what I'm doing. Have you got a concern with it? And if you haven't got a concern, then I need to go ahead and do this, because we're talking about very difficult situations with decisions that have to be made in hours, not weeks and months.
Thanks, Matt. Thanks, Miro. I agree, and I'm sure that would apply to people on personal budgets through social care as well. To absolutely not seek permission, and just go forward and get what you need to keep yourself safe. I'm recognising that some people are saying that they might well exhaust PAs very, very quickly and might not then have friends and families who can come. So then what happens? If people are going to the absolute worst case scenario, I would imagine, and I know that councils now are already putting plans together for life and limb services. So ultimately, if everything else fails, the duty of care then with NHS, your local CCG if you're on a personal health budget, or with the local authority, I would imagine action will be taken for life and limb support. It's not what you're used to, and it won't be what you want particularly, but I don't think anybody should be left sort of without that. So I think use your community, use your neighbours. I think worst case scenario, there'll probably be life and limb support that's out there through the localities in the worst case scenario. So are there other questions, Kara?
Yeah, Julie, there's a really big theme around PAs who may possibly have been exposed through their own family members or through travelling to work or whatever. People asking questions about the kind of levels of what might require self-isolation and what to do if a PA, if you want a PA to self-isolate, but they're saying they're not going to.
Could they say what?
If you have asked a PA to self-isolate and they're saying they don't want to or they're not able to.
Right.
I mean, it may be with some of these, Julie, that we're going to have to suggest that people perhaps get advice from 111 on some of these, because, there is a confusion, I think, nationally about where people are at in terms of their exposure, and, what counts as exposure, and, whether we know whether people are actually testing positive or may just have a cough or cold, who knows? It's hard to advise on some of those, really. So I wonder whether the best case scenario might be to get some advice from 111.
Well, yeah, there's that, and then possibly just some employment advice as well, employers' advice, because if you've got a PA that says, no, I'm refusing to do that, I'm still going to be working with lots of other people, but then people don't want that person in their home, then it's whether or not you can reasonably say, well, I need to suspend you on pay then from the future because I just don't want to put myself at that risk. It's really, really difficult, isn't it?
Yeah.
Can I say something? Oh, sorry.
Oh, go on.
No, I was just going to say, so yeah, I completely agree that people should be looking at the NHS guidance. So yeah, at the moment, it's saying, you know, if you have symptoms, particularly of a fever or a prolonged persistent dry cough, then you have to stay at home for 7 days. If somebody in your home has got that, then the whole family now have to isolate for 14 days. That's been the latest guidance. With regard to a PA, if they are showing symptoms, then the fact that they've acknowledged that they're showing symptoms would infer that actually there's a reasonable decision to be made about suspending their work. Now, you have a few options. One is that if a PA or a PA family are showing symptoms in their household, then they should be isolating for 7 to 14 days, depending on who is the one with the symptoms. But if your PA doesn't want to stop working, then you of course you have the right to suspend them. And again, you could dip into your emergency reserves of PA funding if people have the reserve funding, or of course speak to the CCG about getting emergency funding for that. But the other option as well, the more maybe pragmatic option, is to be a bit flexible. So could you assign that PA to do jobs for you that doesn't require them to be in contact with you? So for example, could they have the responsibility of doing something outside the house? Could they have responsibility to go and pick things up for you? Because of course, through careful, ways of leaving items, in the back room or outside for a number of hours, you can be strategic about moving PAs to do different jobs that may not require them to be constantly with you all the time, which would then limit the risk of exposure.
Thanks, Miro. I think just moving on with some of the themes, there's another really strong theme around making arrangements for contingency and permission to act and permission to do things. So questions like, where might we get the money for bank staff? So I think there is something about helping people think through what their contingency arrangements are. Sorry, Julie, go on.
Yeah, I was just going to say that's something that I think we need to raise nationally on behalf of people, and let both ADAS, which is the Association of Directors of Social Care, and the NHS England to pass to the CCGs, that if those requests go in, something's passed over straight away so that people can assert themselves and start making decisions. If it's just money that's getting in the way of helping people to keep themselves safe, then we should find a way of being able to get that across to people, and we'll definitely raise that nationally.
Great.
Yeah, I also agree on what Julie said, but if you know that you have a contingency in your personal budget, and you know that it's there, and you know it's in your support plan, and you need to access it for the reason of a personal assistant, of finding extra support, is to also speak to your government, if you have one, to say, can you release some of my contingency because I need it because of the extra support that I require during that time. But Julie is right, we should also raise it on a national scale as well.
Julie, just a few more questions as well, just mindful of time. We've had one question around, if there were to be a lockdown, how do PAs get classed as, do we need to write a letter for them to be classed as doing essential work? So where would they get something like that from? And do we need to be doing more testing for PAs? Do we need to disabled people's organisations perhaps need to be doing more to be asking for support in testing of PAs?
Yeah, I think at the moment in the country, the testing is very limited. I think the idea of asking that PAs are doing essential work, yes, I think we can definitely try and get that into some of the national guidance, and of course it has to be classed as life and limb work, doesn't it?
Yeah. Just another couple of themes, and I can also see that Clinton has had his hand up. Are PAs covered by statutory sick pay is another question.
Yes. I think all PAs would be.
Yes.
Yeah. I'm just trying to find Clinton to try and
I'm just see if I can do it.
just for those that are asking about the webinar, we'll make sure that links towards the recording of the webinar will be. We'll get it out on Twitter and Facebook and on InControl's website. We'll try and put it as far and wide as we can to share the recording of the webinar. There he is. Right.
Clinton, I think I've unmuted you.
Hello. Hello.
We can hear you.
We can hear you.
Hello, everyone. It was just in regard about a contingency plan, and the solution I'm looking at is I've got a reserve of former personal assistants on hand, and I'll also have a plan for if my PAs are unable to work. I have checked out that I can use an agency instead, but you might need to inform your council's client financial services so they can authorise the budget and can be altered, because there would be extra costs for an agency, but it's a plan, and I don't know if anybody else are thinking that way.
Yeah, and I think that links back to, I think Andy's put a question up there as well. Andy McCabe has put a question on saying, can I pay extra money to enable people to work different hours, and you know, sort of as an incentive to sort of keep people in. So again, we'll definitely raise that issue about saying, look, there needs to be really strong flexibility around how people use the money, or if they need extra money in these circumstances to keep themselves safe. So that's one thing that we'll sort of work that.
Yeah, I think there's a strong theme, Julie, around help with contingency planning and knowing how to do that and knowing who to talk to really about that.
Yeah. Yeah, and I guess, you know, the first thing people, you know, I've heard people saying that they've tried to get in touch with the local council and they've been sent back to their employees' insurance and things like that. So I think, you know, it's really important that we get this at a national level as well as a local level, and get that in national and local guidance, so that, you know, so that the central government are telling locally that this has to happen.
We've had a specific question around ventilator cleaning as well, which I now can't find, but I think it was around, is there any have people got any advice on ventilator cleaning?
Karen, go on.
Well, yeah. When we first got the ventilator, which is probably about 18 months ago now, ventilators, we were shown how to clean it with basic soap and water. So it's literally, we tend to put the tubes in the bath. We were told to do it once a week, and we've just followed those guidelines ever since. I'm not sure if they're looking for anything else, but it's about wiping the mask every time you use it, and just doing what they told you to do when you got the ventilator.
Yeah, I think it was also about how to keep clean as a person for people who are on ventilators. Is there anything additional or specific people should be doing? I suppose that's for all of us as well.
I would say general hygiene, you know, like you would anyway.
Yeah. So that's constantly the advice, isn't it? It's just constantly washing hands, and keeping that
face clean and dry.
Yeah.
Okay, just to add. Oh, sorry.
Yeah, go on, Miro.
I'm just going to say, yeah, I think it's about persistently reminding your PAs, you know, don't touch your face. You know, don't, if you're going to cough or anything like that, use a tissue, throw it away, wash your hands. If you're going to be doing intimate things, perhaps, I mean, again, it's up to you as an individual, providing you've got capacity to make those decisions. You know, if you're wanting to use a I have a non-invasive ventilator and a cough assist machine. It may be about asking PAs to use gloves at the time of using it, and then obviously binning those gloves and washing the hands as well before and afterwards. But it's just kind of trying to minimize as much contact as you need from your PA as much as possible, recognizing that this won't happen forever. It's just we've got to be a little bit possibly uncomfortable for a few months just to kind of get us through. But it's about weighing out the risks, and obviously for everybody that's different, because some people are more risk averse, some people are more worried about taking risks and so on. But I think trying to minimize that, and also I have a terrible thing in the evening. I always ask my PAs to rub my eyes because I'm knackered in the evening after 15 hours of sitting in front of a computer or working. But again, at the moment I've changed from that now to asking the PA to put gloves on, do me a warm flannel, wash my face rather than rubbing the eyes and so on. So it's just about, can you do things differently, and can you add in layers of protection, which may be a bit cumbersome and problematic at the moment, but there will be an end point where we can go back to the way we did things previously.
There are some resources come through as well that has been developed by people who use this. They said they're similar to rules advice, but written down. So this template advice for letters to support workers and PAs, and we've got some links that have been really helpful. That's really, really helpful, and we'll definitely share that around. And it sort of says, disabled people have to help one another and start preparing for themselves. So there's a lot of detailed templates, letter of support for workers and PAs, and different adaptations of that. Thank you, Francesca. We'll certainly share them across the board. Has anybody else found anything useful, links like that we can share across?
Julie, we've got some hands up. If people could perhaps write, if they're able to write any of those in the question pane, I'll make a note of them. If you want to take some of the hands that are up, we've got Sandra, Gary and Sarah that I can see at the moment as they've got their hands up.
Yep, so Sandra, I'm coming to you now. Hi, Sandra.
Hiya, can you hear me? Yeah.
Yes, we can hear you.
One of the things I thought about was that I only have one PA at a time working, so if my other PAs weren't working, that maybe they could offer support to other clients. But could we get on a national thing that they can get paid if they work for other people if they're my employee? Because that way we could help each other out. Because if I have a team of 4 PAs, but only one works at a time. So if they were willing to help other people, which a couple of my PAs are, is there a way that they could get paid for helping out the other people, even though they're employees of mine, but they won't be getting paid by me, obviously, at that time? And that would be a way that people could kind of support each other with relief PAs and bank PAs. And I don't know if we can get the council to kind of agree that if you do support other clients, you can still get paid, if you know what I mean.
Yeah, and again, I think we should be raising that as saying, what's the way of doing that? And I'm thinking, there could be ways of doing that. There could be local providers that would be willing to issue that payment, so it's not left to individuals to do. Yeah, that's really great. Thanks, Andrew. Yeah, I think that's something that we could really think about and share across. Gary, I'm coming to unmute you. Gary, you're self-muted at the moment. If you click on your mic. Okay, we'll try Sarah. And Sarah, you're self-muted as well.
Can you hear me?
Hello, yeah. Sarah.
Hi. I'm sorry, I was late to the webinar, so this may have already been covered, so forgive me if it has. In the area that I'm in, many of us are really low on PAs due to recruitment issues and poor wage. A lot of us are going without care being met as it is already, because adult social care are not helping with cover not putting funds up front for us to get agency. For those of us that have got very few PAs to rely on, if they go into self-isolation or get sick, we've actually been approaching adults who care about what is on offer, and we're getting absolutely nothing back from them whatsoever. So we're kind of quite worried about, you know, where do we turn, because they're not giving any responses and not even responding to people's emails.
Yeah. So I mean, people, have said, where do we go to once we get to the worst case scenario, and the complete PAs go down, and there's not agencies around that we're able to use, no friends and family. What's the next step? And is it down to community and neighbours, or what's the plan for some sort of life and limb service that will be arranged by the council or local NHS services? So that's something that we'll definitely raise nationally.
That's definitely a position a lot of us are in. We don't have family. A lot of our friends are high risk themselves. I mean, I'm having to self-isolate after my GP contacted me today, and yet I've got absolutely nothing in place to help me get through this.
Yeah. So what I'd say, Sarah, is do have a look at your local groups. Try and start looking at local networks and neighbours. I know it's not ideal, but actually they've been massively responsive over the weekend, because what we need to do is just make sure that people can survive and get through to the other side of this.
Okay, thank you.
Nationally and strategically as well. Gary, can you hear us?
Yeah, I think I've sorted it now. Sorry, I couldn't find a written question box, so I think one question I was going to ask about any help we could get from the CCG, who could we contact, has been answered, and I think you're going to look into that and let us know, so that's great. And the other one is my daughters are the problems, and they're both extremely compromised with various medical conditions. So I was a supply teacher. I've had to self-isolate. We've had to turn down most of our PAs and just keep one or two who we think are reliable to keep themselves hygienic and things. Can I pay myself and my wife out of our PHB, or am I just going to have to rely on carers allowance because I've had to stop work?
Yeah, that's a really good question, and that's something we could raise, isn't it? You know,
I can
because
provide some comments to that. Sorry.
Yeah. But what personal health budgets and personal budgets, it says that families in the same household where appropriate. So I would say yes, if it's a life and limb situation, it's appropriate.
Just to add to that, because we've got a similar situation where my partner is spending her job in Cambridge to come home to take some pressure off the existing PA support system, and we're asking that exact same question, because normally she would be, there'd be a tendency not to ask her to do the work because she lives in the same home. I would go down the route of being assertive to the CCG. Don't ask them. Say to them that this is an emergency situation. The people who live in the home will need to be employed as PAs for the short term to address the immediate crisis happening. This is what we're doing. You have 40 hours to respond with any concerns. Otherwise, I'm going to put myself on the payroll to do this because of the situation of life and death. And again, there are some resources. If you look at the likes of Luke Clement's website on resources, Professor Luke Clements, he's got some some resources where you can challenge any kind of commentary or decisions that are made by CCGs or local authorities. But again, I would just say to them, this is what I'm doing. This is why I'm doing it. If you've got a problem, give me a response in this time frame. Otherwise, I'm going ahead and doing it.
Yeah.
That's pretty that guy's name again. Luke Harris.
Appropriate.
Luke Clements. Luke Clements.
That's another reason for being more appropriate than this, Gary.
Pardon?
Thanks for your question, Gary. From Tessa.
Thank you.
Hi. Thanks for sharing the document. I've got a 24-hour care package that is funded when ILF went. I never got full funding, so it's a mixture of direct payments through the local authority, CPG and access to work. So I just really appreciate Miro's advice on like where to go with negotiating, because I work as a campaigning professional and I've struggled to get a budget together. So in this instance, I understand it's a crisis. And my second question is, as someone who has had difficult experiences with PAs where they've been dangerous in terms of stealing and then I've had to fire them, what guidelines are being issued for when, if our care falls through and we're having to rely on the community because we don't have a family available, what safeguardings are national government advising there? Thanks.
Thanks. Do you want to answer the first part of that, Miro, first, and then I think me and Kara can pick up on some of the community support safeguarding.
I didn't get exactly the question in the first part. If I could be repeated.
Yeah, thank you. Sorry, it was just any tips you have around negotiating with CCGs. I've got a mixture of direct payment, CCG, and access to work that give me a 24-hour package. Once ILF was destroyed, and as a result of that, I don't have one person to go to. I've just got a duty social worker, and I've been waiting for a call back for over a week. So yeah, it was just tips for negotiating.
Oh yeah, I remember the golden days of the ILF. So I think there's a couple of things I would do. One is that I would set out what the things that you need to do, and then see if if some aspects are specific around the CCG funded, or some aspects are specifically around the access to work or for the social care. And then, as I said before, just fire an email off, just so you've got written documentation to say, I informed people what I was doing. Now, my assumption would be, I don't think many of the providers are going to be that concerned about the decision making we're doing in the short term. It is short term, it's crisis driven, it's not illegal what we're asking to do. And of course, the question is that if you've got capacity, I would look at the statutory guidance just to make sure that you're not going against any of the statutory guidance. And things like employing, family in emergency situations, putting people onto, bringing people on a temporary basis and so on. I think you are well within your right to do that. It's just about making sure that you're informing people at every point, so that there is a documented trail of evidence to show your decision making. And as long as you are setting out clearly what you're doing and then explaining in your own words why you think it's justified, you'll be in a stronger position. And of course, if somebody does come back at any point and says to any of us, no, we don't allow that, to ask the people, show me in the statutory guidance where it says I cannot specifically do this right now. And I can imagine that in most circumstances they won't have anything to say back to this.
Thank you so much.
Yeah.
Just to say very quickly,
Yeah.
I'm happy to support anybody in terms of around talking to the CCGs or talking to local authorities. I'm working from home now. I've got a lot of time. My teaching's about to finish in April, so I'm happy if people want to send me an email, and I'll do all I can to kind of have chats with people about directly talking to CCGs and so on.
Thanks, Miro, and certainly we'll do the same as well. So tactically, the advice there is send an email to the duty social worker or to the team manager or wherever your money comes from and say, I'm feeling I need to do A, B, C, and D to keep myself safe. Let me know within 48 hours if there's an issue with this. So on the second part of that question, it was around safeguarding in using neighbours and supporting agencies. So a lot of these groups like coronavirus and corona aid and mutual aid groups, there's been a lot of sort of community webinars and community strategy to try and say what's the safeguarding arrangements in this situation. So I know Kerry, that's from Levy Corona Group, their group have recently just done some safety guidance. Kerry, are you able to just chat through some of that?
Yeah, I think this has been a major theme for us. So on Friday, I set up a little Facebook group where I live, and here we are on, is it Tuesday, and we've got nearly 600 people on it. So kind of feel slightly overwhelmed by trying to kind of keep it in order, really. So we wanted to keep things really simple and keep it really neighbourly. And this is about people doing things that they do for neighbours and behaving as good neighbours do and looking out for each other, but also recognising that sometimes people might need a couple of things from the shop or may need more than a couple of things. And I'm hearing that, you know, getting Tesco's to deliver at the moment and other supermarkets, you know, the nearest dates are 4th of April and all kinds of things. So we've produced some guidance which is available on the Corona Heroes. It's pinned to the top of the Corona Heroes Facebook page. It's just some thoughts really around people keeping safe, around managing money and helping people with money, because that's always a tricky transaction when you don't necessarily know people, and what to do around things like electricity and gas keys. So have a look on the Corona Heroes pages to download that. It's not definitive advice. It's just some thoughts that we had with some knowledge, a little bit of knowledge around safeguarding.
There's also a webinar on tonight from COVID-19 Mutual Aid that's around how to safeguard in groups. So there's a webinar, so we'll certainly share anything that comes from that webinar as well. And then I guess the other things that are happening locally, trying to make sure that there's no money that changes hands. So there's, at the moment, there's a bit of a process on financial abuse and scamming with old people. And I guess my view is if we can try and get this to neighbourhood areas, so we've literally got street by street, people living on your street or living on the next street is probably the best bet for trying to keep people safer than just having random helpers coming in from we don't know where. So we're certainly trying to work on a very local postcode basis. I don't know whether we'll achieve it or not, but ideally, if people are living within one or two or three streets of each other, there's much less chance of abuse because the whole community is watching than sort of random people coming in out of area.
Yeah. Julie, I can see we've got a lot of hands up and so many questions that I just don't think we're going to get through. Can I just pick out a couple of additional themes? Would that be helpful?
Yes. Yeah.
One is around, we've got a couple of people asking about if your personal budget is currently paying for a day centre and the day centre gets shut, what arrangements can you make? And another one is around the role of insurance companies. I mean, one person has said they've been advised by their insurance company to make sure all their staff have personal protective equipment, but adult social care have said they can't buy it using the direct payment can't be used for that. And I think Sue Bott has also raised a question around the role of insurance companies.
Okay, I wonder whether we sort of take away an action list, take away some of these questions. If it's helpful, let's set another webinar up, because I know that this was massively oversubscribed. So I think there's possibly another 150 people that tried getting on to this webinar that have not been able to access it. So what we'll do is we will arrange another webinar, but we'll also start doing some an action list of things like I can talk to some of the insurance companies. I can certainly talk naturally to make sure in the guidance that they've got some flexibility of spend, and make sure that that issue of personal protective equipment is high on the agenda. And there's a few other notes that I've got to raise nationally. If there are other things that people say we absolutely need this raising, if you can email them in to us at admin@in-control.org.uk, we'll start collecting the list and we'll set up other webinars so that we can carry on. If we try and get a few webinars set up over the next few days to give people a chance to be able to get in and raise and talk about these concerns. So that's it. I think we're going to finish it there. Many thanks to Miro, Karen, Will, Liz for sharing your experiences. Thank you all for sharing everything you have done online. Thank you, Kerry and Jane, for administrating it. And we'll be back in touch with other webinars. It might be that we do some very specific on employment issues and something else specific on protective equipment. We could, we could break it down into different subject areas. And keep in touch, stay safe, and thank you for joining the webinar.